I want to welcome you to Home for a Day. It's very, very nice to see you here this evening. And I particularly want to thank Susan and Linda and John, if he shows, I hope he will, for agreeing to be on this panel. Basically, the format is that each one of us is going to talk for a few minutes. There's actually a clock behind the potted plant here to keep us on track. And then I hope that we will have plenty of time, 40 minutes or so before 9 o'clock, for questions and for discussion. The amount of growth that's taken place in this community in the last 15 years and in the 15 years to come is just phenomenal. 15 years ago, Reserve Street was a two-lane street with two stop signs, one at South and one at Third. My wife left Missoula after 20 years of living here in 1990, and when we came back, she just went into shock when we drove down Reserve Street. She couldn't believe it. Here's another example. The Missoulian is doing a series of articles on the planning areas of this county, and this one is on the Swan. And I just picked out one quotation. If Plum Creek opts to sell its lands to private developers, the entire dynamic of the valley will change. The prices for that land are going to be so high that the people who buy them don't need to work. Nobody here working for a job can afford to live here. The acreage is going to go for $10,000 without power or sewer per acre. The county has had 21% growth in the last 5 or 6 years. That means when you look around that 1 out of every 4 people you see is over 60. And 1 out of every 8 people that you see is over 60 and living on $10,000 or less. So it's not particularly sanguine picture when we talk about the growth of seniors in this county. There are going to be huge problems. I want to say, I'm not an economist, but I want to say one other thing about the kind of growth that is happening here. All through the 20th century, Missoula this county was, the engine, the economic engine was what is called earned income. That is income earned by people with jobs. Truckers, loggers, people in the railroads, people in the health industry, people earning their living, people between 25 and 50. That is no longer true in this county. As of 2005, for every dollar of earned income, there was also a dollar of what is called transfer income. And transfer income is income from 401ks, from pension plans, from stocks and bonds. It is from Medicare, Social Security. I have a little trouble with that term because I think that I earned my Social Security, but in fact it is a transfer revenue for me. And the trouble with that scenario is that transfer revenue forces earned income out. In other words, the more of us that are here living off of pension funds, the harder it is for somebody 25 to 50 to be able to afford a home near a school and raise a family. So that's part of what we're looking at 15 years from now. If you think of all the changes that have happened in the past 15 years, the coming 15 years is going to be mind-boggling. And of course, the struggle is how to maintain the quality of life that we enjoy while accommodating the fact that there is a phenomenal social and economic dynamic taking place right in front of us. Susan is from Missoula Aging Services, and she's going to talk about how to grapple with providing services for people when so many of them, in fact half of them, are within $1,500 of the poverty level in this country. Thanks.
Good evening. I'm not going to talk entirely about doom and gloom because my feeling is that the baby boomers have defined every decade they've moved into, and that the baby boomer generation is watching currently their own parents aging and kind of taking note of it, and hopefully as a result of that will look at life a little differently than our current elder population that didn't plan on longevity. And it might take longer, the tail end of the baby boomers, to kind of fully get it, but I think there is an opportunity. There's as much of an opportunity as there is a reason to be concerned at this point. And I think that they're going to want to do things differently. My hope, of course, would be that people will recognize that a good 80% of aging is something that we have some control over, whether it's our diet and exercise and our ability to take better care of ourselves. So some of the more debilitating illnesses that our current elder population is experiencing, whether it's diabetes and heart kinds of issues, and of course we all know a lot of what happens sometimes as we age, that some of that will be lessened by the fact that we observed how debilitating that can be as we age in place. Do you want to acknowledge who just walked in the room?
I would prefer that no one did.
I'll only talk about the demographic elephant in the demographics they're dealing with, as opposed to somebody walked in the room. Hi, John.
Hello, Susan. How are you?
It's always a pleasure.
I'm sorry, it's been one of those days.
We do understand.
Thank you.
So anyhow, I had the privilege of representing Montana as one of the delegates to the White House Conference on Aging, and it's only held every 10 years, and it brought 1,200 delegates from across the country together, and the purpose of it was to take a look at the current aging population in addition to the next 10 years and make some recommendations of policies that might make aging a little easier for everybody. It was an incredible experience to be with as many people many of them have served even longer than myself in the field of aging, which is probably not saying much, but and had some, a passion to what they did and what they observed, and I guess my hope is that if Congress and the President pay attention to what came out of it, then we might see some turnaround of what that's more of an opportunity and a benefit to longevity than to some of the fears and concerns that we all rightfully have at this point. The first, I wanted to just highlight the top 10 areas. There were 50 resolutions that were passed, and there were strategies developed under each of those resolutions to be presented to Congress. A full report will be given to Congress and the governors and the President in June, a full written report on all aspects of all 50 resolutions. But I'll just touch on the top 10, and I'll try to keep to my time, which I'm assuming you'll do something like that on the table or whatever's necessary, and then it'll take me 5 minutes to acknowledge that. But anyhow, the first thing was the reauthorization of the Older Americans Act within the first 6 months following the 2005 White House Conference on Aging. The Older Americans Act is the funds the Administration on Aging, or Congress funds the Administration on Aging, and its intent is to give money to organizations like mine, which is considered an area agency on aging. And we're considered the focal points in the communities for aging issues and services. We're required to do a planning process to understand the gaps and concerns in the community, and then we're to develop a plan in partnership with a variety of organizations, public and private entities, to try and address those concerns. And so Congress allocates dollars to the Older Americans Act, which in turn comes into the states, and then you'll see it in the fashion of Meals on Wheels, congregate sites, and it's very different in different areas. Sometimes it's personal care, sometimes it's respite services, so it's transportation. It's basically the home and community-based services to try and allow people to age with dignity and maximize their independence. And so the reauthorization of this is one thing, but where they want to really focus on is of course, money, which is it's been underfunded for years. They believe that area agencies have the opportunity to work with communities, the public officials, to better prepare for the aging of their communities. And they want to be able to fund, with our knowledge and resources, the ability to work with communities like Missoula to better prepare. So that was the number one recommendation out of the White House Conference on Aging. And no, all delegates were not Area Agency on Aging directors. In fact, there was very few. The second area was to develop a coordinated, comprehensive long-term care strategy by supporting public and private sector initiatives that address financing, choice, quality, service delivery, and the paid and unpaid workforce. I think the statement speaks for itself. A comprehensive long-term care strategy is clearly what we need in light of the demographics we're talking about. And I think we need to have everybody involved in how that happens. The third was ensure the older Americans have transportation options to retain their mobility and independence. The current statistics suggest that people will outlive their ability to drive by 10 years. And so what are their options in terms of transportation? And I think what they're doing is they had an exhibit there that had some of the newest technology available, and they were talking about the smart fit cars that will adjust to you and make all of the compensations to keep you on the road as long as possible, and of course as safe as possible. But it won't ever take away from the reality that people will have to stop driving, and that the communities will need to have reasonable options in order to sustain a person in their own home and their independence, grocery shopping, medical appointments, visitation. And I think Missoula's done a pretty darn good job with the resources they have, but obviously there needs to be more options. There's some pretty neat pilot projects where people can donate their cars, and the value of that car can be basically they can turn in and getting free rides on the value. So there's some innovative things that can be done. I think our community needs to be a part of some of those pilot projects. Strengthen and improve the Medicaid program for seniors. You know, when I first wrote this, Congress was already voting on cutting aspects of Medicaid, and now the president's proposed budget for '07 puts further cuts in Medicaid programs and Medicare, and I'll talk a little bit more about those proposed cuts and what I think we need to do as a community and a nation in that regard. Strengthen and improve the Medicare program. You know, maybe many of you in the room have had experience either with your parents or yourself with the new prescription drug coverage. And I clearly don't know who was sitting in a room that developed that program. In fact,
It wasn't seniors.
no, it's largely you have to have some technological expertise in where the generation that would most access that is not is well versed in technology. In fact, those of us that have some knowledge were challenged. I think they should have set up a degree program at the university on how best to sort through Part D.
They have.
That's true, they have.
One credit course.
There is, in fact, one of my staff is helping with a
wow.
one-credit class on how to sort through Part D. Of course, the recommendation from the delegates was to gut the program and go back and look at the way the VA system has it, which is the government negotiates the drug prices. It's been very successful, and it's a one plan that people can purchase, and I think it was an effort to privatize, and I think if that's an example of privatization, I hope you share in my feeling that it's definitely the wrong way to go. And we made recommendations that we think that program doesn't need to be tweaked and changed, but gotten rid of and reestablished in a better fashion. The sixth area was support geriatric education and training for all healthcare professionals, health professional students, and direct care workers. A favorite person of mine in the field of gerontology is Dr. Robert Butler. Maybe some of you have heard of him or come across him in some of your research or studies. And he said, we must create geriatrics in this country. How can we maintain vigorous and healthy older people if we do not have doctors that are well trained to understand the very special clinical differences? Just as we have pediatrics, we must have geriatrics. He went on to say that while we were meeting and voting on the importance of education and healthcare workers, Congress voted to dismantle Title VII of the Public Service Act, which is the basis of training for geriatrics in the United States. This was a mere $31.5 million out of a federal budget of $2.3 trillion. Simultaneously, Congress supported the appropriation of $300 million of propaganda money to convince Iraq that the U.S. is doing the right thing in their country. I think we have some problems with priorities. And so definitely, and I think I'm preaching to the choir to many of you in terms of going to either accessing health care and doctors not understanding some of those clinical differences in how medication affects older people, and a variety of other issues. And I think Linda's going to talk a little bit about the shortage of healthcare workers in general. Our country needs to start investing in that now. We're already in a crisis. Promote innovative models of non-institutional long-term care. Clearly, it's the sentiment of most people that they don't want to end up in a nursing home. Nursing homes are necessary. There will always be people who will need nursing home level of care, but there needs to be more community-based options for people prior to ever entering in a nursing home. And so it was nice that that is a national strategy that's being suggested. Improve recognition, assessment, and treatment of mental illness and depression among older Americans. That's not a part of aging. Getting depressed is not a part of aging. And so we need to come up with some strategies there. Attain adequate numbers of healthcare personnel in all professions who are skilled, culturally competent, and specialized in geriatrics, and improve state and local-based integrated delivery systems to meet the 21st century needs of seniors. And one of the recommendations was, for example, Medicare needs to equalize their payment system to the private insurance. There's no incentives for physicians to get into geriatrics at the reimbursement rate that physicians receive. You already may be familiar with the fact that physicians are declining to take Medicare patients because of the reimbursement rate. And we're suggesting that there not be a difference in that. We need to invest in basic research on aging, which includes further support for the National Institute on Aging. Dr. Butler says frailty and dementia are certainly the twin disasters of old age. He refers to Alzheimer's disease as the polio of geriatrics and the nursing home as the iron lung of geriatrics. Fix Social Security, but there was probably 85% of the delegation that said privatization is not the way to go. And develop a national campaign that will address our lifestyle and to increase people's awareness of personal responsibility and affecting longer and healthier lives. So those were the top 10 areas that and recommendations that were made at the White House conference, and there were 40 more. And so how's that impact us on a local level? Clearly, continuing to provide home and community-based options for people to be able to stay in their homes as long as possible and to stretch their resources as long as possible is a good example. I will mention that the unveiling of the president's agenda or budget for this next year is further cuts to the programs that I mentioned under the Older Americans Act. They're talking about completely eliminating the commodities supplemental food program, which currently is called Roots in Missoula. The Missoula Food Bank delivers commodities to low-income elders once a month in our community. They're reduced by 9% this year, and next year they're proposing to zero it out completely. So, and the cuts that he's recommending to the programs that we're involved in are the nutrition programs, and most of you are aware of the value of nutrition in terms of healthy aging and recovering from illnesses. And he's recommending some significant cuts. And on a local level, I'll let you know that the Meals on Wheels program is going to have a significant deficit by the end of June, which is our fiscal year, with really no options at this point of how we're going to change that for the coming year. And as long as I've been at Aging Services, which is a long time, we've never had to put a waiting list on Meals on Wheels. I can't imagine somebody coming out of a hospital from an illness and telling them that we'll put them on a waiting list, and if they still need it in a couple of weeks and an opening happens, we'll check in with them. That's exactly how I feel.
And your time is up.
Okay, so my time is up. So we have to look at, as a community, do a couple of things. One is increase the amount of volunteerism that's around, because I think that's an untapped resource that can make a difference in stretching out our programs. We know we need to stop being silent about what's going on with the federal budget. And we need to look at our own future and aging and take personal responsibility as much as we can. And I think as a community, we need to come together and plan on how to make Missoula a good place to grow old in. Thank you.
Hi, I'm Linda Henderson. I was pleased to be asked to participate this evening. I'm a registered nurse here in Missoula and have over 20 years of experience in providing services to seniors in their home. I have been active in the community with Missoula Aging Services, and I can tell Susan that her time is up because I frequently did that when I was chairman of the board. So I have experience in that regards. Currently, I am also serving as the president of the Montana Nurses Association, and I'm happy to see all of you here this evening. Felix asked me to speak primarily around the topic of aging well in our community and how we can promote seniors staying at home as long as possible. And you're going to hear me echo a number of the things that Susan mentioned in the White House Conference on Aging's priorities, because those have been established as the best ways to have seniors continue to participate in their community, as well as to manage our fiscal expenses related to aging and some of the disabilities that occur with that. So our premise here is that we want to look at what are the values and preferences of those older adults and their families in the community. What do they place value on in terms of where they want to be in their aging process? And we also want to address fiscal and policy issues for aging societies. And certainly the United States is that, and Montana is going to be a shining star. They're already well on their way, and very soon the majority of our residents are going to fall into that population category. So we all have constraints on our resources, but we also have some opportunities at this point in time to plan for this baby boomer generation coming down the pike. That's basically here, but we're at the tip of the iceberg right now. So our goal in promoting healthy aging is we want to, of course, delay onset of disability. As we age, we have certain physical as well as sometimes mental problems that occur that can lead to additional strains on resources. Anything that we can do in terms of our self-care, and I'll talk more about that in a little bit, to minimize those disabilities will help promote healthy aging. We want to optimize people's functional capacity, meaning if we can, if they do have problems with bathing or dressing or doing their meal preparation or getting around for transportation, what are services that we can provide to supplement what they already have in the community to keep them at home. There should be an emphasis on community participation. So we want really to maintain a mix of social care along with medical care. We want to enhance their self-care capacity, so doing for themselves. We want to reinforce their social network and family network that they have, because these have been identified as very strong components of staying well in general, and particularly for older adults. We also want to focus on what does the older adult still contribute to the community, as well as their family and others in their social network. In addition to, many times we tend to focus on the negative in terms of what services are required by that individual, what outside support do they need, but many times we tend to lose sight of what is the social contributions that that individual continues to make to the community and to their family, despite the fact that they may have limitations upon what their normal activities would have been in the past. So if you think about a model, we really in the center have a senior or an older adult, and we want that person to take responsibility for their self-care. And you're going to be hearing more and more about this because from the standpoint of our fiscal responsibilities, we are wanting to limit how much we're spending on health care. And the way that you do that is you put more of the burden on the individual. But there are many things that we can do as individuals to promote our own self-care and to actually take control of our overall health care. So some of those things obviously revolve around preventive health care measures to decrease any illness or disease and also to improve our quality of life. Things like no smoking. So if you smoke, getting help to quit smoking. If you don't smoke, don't start, despite what they say. You know, you're 85 and you've never smoked and you think you might want to try it. Well, okay, but it can lead to bad things. Moderate consumption of alcohol. We're not saying that you don't have to drink at all, but if you do want to drink, you should be moderate in that. And as you get older, your body doesn't take alcohol the same way it used to. It takes a lot longer to break it down, and so from the standpoint of how much you consume, you need to take that into consideration. Maintaining desirable weight. A lot of these things I'm talking about are things that all of us need to practice, no matter what our age is. And we need to start as young adults, and so that it becomes a habit as we grow older. But certainly maintaining an ideal weight for your height is very important. Exercising regularly. For older people, that may not be that they can get out and walk if walking is what they used to do. But maybe that means that they get a treadmill, or that we arrange for transportation for them to go to the mall to do the mall walking. But staying physically active is important. And that exercising can take into account things like gardening activities as well, bicycling. As I think that we're beginning to recognize that being active throughout our life leads to not only that our physical muscle capacity is maintained in terms of being able to do normal daily activities, but also it gives a boost to our mental health as well. Maintaining a balanced diet, limiting consumption of fatty foods, although if you've listened to the news over the last couple of days and women and the study on women's health and preventing cardiovascular disease, I just want to point out that the issue there was that they really didn't take into consideration the types of fats and that there is still recommendation to avoid what we call trans fats, which are the deep fat fried types of things, and processed foods have trans fats or saturated fats like in meats. So you want to stick with those monounsaturated fats, and those are the good ones. Maintaining social integration. What do I mean by that? That means that if you have participated in social groups in the past, we want to continue to promote that. We want to continue to have you attending church if you've been attending church. We want to keep you attending, if you go out and play cards regularly, to continue to do that. And of course, one of the things that we face as we grow older is that we may lose our spouse to death. And that sometimes then that really changes our social patterns. So recognizing that as a society we have to learn how to help people reintegrate after losses so that they maintain that social integration is very important. Another thing that you can do for good health practices is that there have been a number of screenings recommended that people routinely participate in, and that your healthcare provider should be helping you to participate in. So those are things like having your blood pressure checked for high blood pressure and having that treated. Looking at the medications that you're taking and making sure that there aren't negative interactions going on there. Infectious diseases. When I say that, I'm looking at primarily things like immunizations. How many of you got a flu shot this year? All right, pretty good, pretty good. How many of you have had a pneumonia shot? Okay, a few. So those are two of the basic things as seniors in terms of our immunizations that we need to be aware of to promote health for ourselves as well as those around us. Osteoporosis screening, very important to do. Many times it's that one fall that breaks a hip that leads to the recognition that there is a problem with osteoporosis, and that many times then becomes the downfall or the negative towards loss of good health. Sensory losses. Hearing is one of those, eyesight. Those are probably two of the most important ones that we think about. But also balance is a sensory loss. If we're no longer able to maintain our balance, which can lead to falls. And there are compensatory things that we can do to help with that. Having good oral health, going to see a dentist, making sure that if you have dentures that they fit properly, because that affects how well you can eat and your nutritional status. Cancer screenings, we've talked about the nutrition and smoking. Having a depression screening. Susan talked about depression not being a normal part of aging. It isn't a normal part of aging. We do have losses and we have to deal with losses, but being depressed is something that can hit you at any age, and that we have very effective treatment for that now. Physical inactivity is a risk that we want to screen for and hope to prevent. We talked about that, and social isolation is also we've already touched on. Educating yourself about any type of illness or disease that you have, and then what you can do about it. So as healthcare providers, we have a responsibility to make sure that you know what is wrong with you, if you're taking medications for it, what effect they're having, and to tell you how you can help do self-care to manage your illness and maintain it at a baseline that will prevent it from causing additional damage for you. We also want you to ask questions of your healthcare provider, and sometimes that's difficult to do. It's a little overwhelming when you're sitting in there in your little gown and nothing else on. And so I always prompt people that think about those questions before you go in and write them down. And I go with my list, because naked fright affects us all. So if you make a list ahead of time, that can help you out with that. But it's important to talk with your healthcare provider and to negotiate your medical choices. What are the choices that you have? Because you do have choices, and it's important to find out what they all are. Increasing your awareness of health service agencies in your community. And this was kind of an interesting thing for me, that in doing a little bit more research about this topic in preparation for tonight, one of the things that was pointed out was that many individuals depend upon their physician to make referrals for them and to know what's available in the community. And in fact, physicians tend to be very uninformed about what community resources are available that might improve their elderly patients' functions. And so whatever you can do as far as informing yourself about what services are available can help you better your self-care in terms of what you need to maintain yourself at home. And I want to put a plug in for Missoula Aging Services and their information and assistance program that can help you find out what resources are available in your community. How am I doing? Probably over time, and you're not telling me to shut up yet, though. All right. The other things I want to talk about have to do with environmental interventions. So there are ways that we can adapt our homes to make them accommodate us if we have physical limitations. Putting things as simple as grab bars by the toilet or by the shower or in the tub can make a difference. Bath benches in the tub to be able to get in and out. Elimination of dangling cords or throw rugs, things that might cause a fall are really important. Any hazards like that you can trip over, because many times that fall is what leads to a disability. Barrier-free environments in public places, and the thing that's wonderful about that is that creating barrier-free communities really benefits more than just seniors. It really benefits everyone in the community, from young people to old people, from the standpoint of eliminating handicaps to accessibility and being able to get around easily. And then also we want to look at how social investments can enhance an older person's self-care, and how they can be cost-effective and really result in enhanced mobility for all people. Social networks then are another component around this person in the center, and this is really the socialization and life satisfaction that individuals get from their community, as well as what assistance they need in meeting their activities of daily living and personal care. So if they need assistance from someone outside the home to come in and help them, or if it's just family members who are helping them, there's a socialization process that goes on during that time. Family are the major support systems of elders. Really about 85% of the care of the elderly happens by family members in the United States. And from the standpoint of nursing homes, it's only about 3.5% of your total population over the age of 65 that is in a nursing home at any one time. So a very, very small portion of your senior population is going to need that long-term care. The thing that we need to recognize from the standpoint of family support is that it's a significant time commitment on their part. And it's really that they need to be able to frequently respond to unpredictable demands of the caregiving situation. So sometimes that means getting up in the middle of the night to meet needs. Sometimes that means dealing with situations where they may need some technical knowledge that's been provided to them, but also they're relating to that person on a caring level as well. So for instance, if they're caring for their parent who has Alzheimer's, who's becoming combative, they still have to deal with the fact that this is their mom or dad and provide support from that standpoint. So recognition from employers and others in the community about what kind of demands that care then places upon their time and their ability to hold down a job is very important. And programs that we can put in place to support that are helpful. Friends and neighbors are also part of that informal support system. So friends are very important because they many times influence the health practices of the individual, and they're usually the best source of emotional support for an elder person. Neighbors are the best support for emergency services. So the daily monitoring that neighbors do for their senior neighbors in the neighborhood is really very important from the standpoint of very little time commitment, but able to alert additional help if it's needed, just from the standpoint of, oh, Millie didn't come out and pick up her paper this morning. She always comes out and picks up her paper. I wonder what's going on, and going over to check on her. So, and then from the outer level, we really have the more formalized social support systems and healthcare networks. And we need to very much more have a focus on chronic care. Our healthcare system is very focused on acute episodes of care and dealing with an acute hospitalization or an acute exacerbation of an illness, and we really fail to take into consideration what are the chronic problems that require ongoing care of people, and to provide the necessary funding to support individuals in that chronic care in our community. I think I'm probably over my time, so I better stop. But one of the points I'd just like to leave you with that is that the best type of community health care for our seniors has to be some form of service integration and managed care of those resources to support that person. And that there need to be at least as many services focused on aging individuals in a society as there are for juvenile dependents. So if you want to ponder the extent to which our societies have built a network of services dedicated to young people, and can you think about all the resources available in our community that focus on youth, we should anticipate that the size of the construction effort that will be required to build a similar set of social institutions serving our aging population. Thank you. We're going to go around the tulip here, I think. You came late, so we put you at the end.
You know, and it's actually very rare that I need a microphone, but since I have one, thank you all for having me this evening. One of the reasons I'm late is I knew Susan was here, and I knew that I really,
All right, touche.
I really wouldn't have that much time to speak. And frankly, I'm glad about that. You've heard from folks who are tremendous resources in our community, and Susan and I spent an hour or so a couple of weeks ago touring aging services, and as the mayor of my hometown, I can tell you I am proud, and the community is privileged to have such a remarkable resource available to all of us. And it's not just for seniors, it's for the folks who live, love, and help seniors. So thank you for your work, and thank you, Linda, as well. These are lots of thoughtful remarks. I'm a politician, so they're less thoughtful, but they're remarks nonetheless. One of the things that I'm interested in talking with you about this evening is where do you want folks to live in our community? Commissioner Carey and I have been talking about this on and off in various capacities in our interesting careers for at least 10 or maybe a dozen years. Where do we want folks to live in our community? And as someone who spent the last 9 or so months talking about affordable housing opportunities for folks in our community, it's not just about young people, it's about folks who aren't as young. And it's about equity, and it's about opportunity. And I'm 41, and I was born when my dad was 43. And I'm 8 years old, or 8 years younger than my brother. And a couple of years ago, I started doing the math and trying to put all this together. And I'm thinking, this was either strategic or not so much. And I'm thinking not so much. And I'm here, and my folks are still here. They live in the house I grew up in on 2nd Street. And my mom, who's a little younger than my dad, for years and years now, has said, when the time comes, I would like to live on the river, at the Clark Fork Manor. And I think that's wonderful. And I think downtown is the place where we can provide lots of opportunity for seniors and young people to live. And for young people, it's an opportunity for equity, and for older folks, it's an opportunity for community and affordability and relationships. So I'm on the campaign trail, and I spend a lot of time, responding to invitations to speak at lots of different locations under lots of different circumstances. And under a couple of those circumstances, I ended up just west of Reserve Street in retirement communities that I can only imagine are a little bit expensive and awfully isolated for my taste. And so what I think we need to provide in our community is choice and opportunity. I would like to think that downtown Missoula is the place where we do that. A month or so ago, there was a small effort to change the way our zoning in what we call the Central Business District operates. That is, there's a move afoot to I think limit the possibilities for building close to sidewalks, being vertical, and in my opinion, sharing walls, ceilings, and floors. I think that's where our real opportunity is for seniors and young folks and anybody in between who's interested. With each passing year, I become less interested in mowing the lawn than I was the previous year, almost to the point that I'm 14 again and arguing with my dad about mowing the lawn. The Central Business District is a place where we can get tall, where we can come close to sidewalks, where we can be, as we are in this setting this evening, 3 blocks from St. Patrick Hospital, which is important to a lot of folks, but we're also 2 blocks from the river, which ought to be as important to folks. This isn't all about your access to health care, it's about your access to life, right? And part of that life is young people. So folks starting out can have the experience and the opportunity to mingle with folks who are kind of finishing up. And I think that's terrific. I think places where people can get together and share experience, share knowledge, share their lives is really important. In Missoula, Montana, as Bill and I know, the price of doing business has almost everything to do with the price of land. And land is scarce, but sky isn't as scarce as it might otherwise be. So when we talk about, I'm thinking 2 blocks from here on the corner of Orange and Broadway, there's a building going up that's 2 stories high. And I want to say there are 3 residential units in that building and some commercial units. And in this case, I think you have to be fairly well-to-do. I think you have to have some means to live in the condominiums upstairs. But that isn't what downtown has to be. That's a piece of it. That's one of the choices. But I think we can also make choices about 1-bedroom units. I think the Clark Fork Manor is a model that can be repeated over and over and over again in downtown Missoula. And I think there's lots of incentive for folks to do that. And I think we need to have some political will to do that. I think we need to have some advocacy to do that. And I think we need to look at some different models for the way that gets done. Bill's been talking for years about senior cooperative housing in general. And I think that's a great model. We just need somebody to step up and try it. So as mayor, that's one of the things I can do. I can be an advocate. I can create tension. I can suggest to folks that we don't need to do business the way we've always done business. I can suggest to folks that we can change some models and we can think about the things we're doing. And we can make some choices about accommodating more folks in our community. I'm the last of the baby boomers. I was born in 1964. And if I understand all the demographic information, somebody's got to take care of me.
Good luck.
That's what I'm thinking. So if today I can work with all of you in our community to build opportunity, to build choice, to create options for folks, that's what I'm going to continue to work to do. We've had struggles in our community about where folks ought to live and under what circumstances they ought to live. And there's a portion of our community that's very interested in folks being able to live in the houses they've lived in for a long time, on 5,500 square feet of lot or 7,500 square feet of lot or more. And that's fine, and that's appropriate. And I don't blame folks for wanting to live that way. But we need to provide some choices. And I think those neighborhoods can last and last, and I think young families or folks with means can move into those places and do just fine and have a wonderful life. I think we can do the same thing in other places. I think we can do that downtown. I don't think we need to isolate ourselves. We need to start figuring out ways to say yes, because we've worked pretty hard at saying no. And I think this is a community that can say yes. I think this is a community that can kind of buckle down and figure out, we're going to draw the line here and here, but we're going to open the door here and here. And that's important. So that's my shtick this evening. And again, as a politician, I'm happy to say yes to whatever you need me to say yes to this evening. I get a lot of that. And I'll refer any difficult questions to Commissioner Carey. But I really believe that we can work together, and this is a great place to do it. And downtown is a fabulous place to do it, for all sorts of excellent reasons. So I look forward to any questions you might have as we proceed this evening. I'll note that while we're here, at least one member of the audience and I have toured West Broadway together recently in a vehicle. No one was injured. We met with some agreement and a little disagreement, and that's Missoula. But there's nothing we can't overcome. So thank you very much.
Thank you, John and Linda and Susan, very much indeed. As a certified 76-year-old lifelong cripple, there are a couple of things I want to reinforce that I've heard here this evening that I really believe in. The very best, I think there are three things that we can do for seniors that are more important than any other things. One is socialization. Seniors tend to get isolated, tend to want to sit in their chairs in front of TV. That's bad. And the more that we can put seniors into social situations, the better. That's one of the reasons I believe in the downtown, John. I really do. Appropriate exercise. I have to say, appropriate exercise saved my life when I had polio years ago. And that's very hard for seniors. It's much easier not to exercise. And what is appropriate? Just walking can be appropriate, or even less than walking, but just exercise, getting up and moving around is very important. And the third thing is this, and it's something I know a lot about, frankly, because in my polio experience, what lasted longest wasn't the physical handicap or any of that stuff. It was the memory of fear. And one thing that seniors, getting older is a very, very challenging experience. And there's a lot of fear in it. Will I outlive my money? My dad outlived his money by about 5 or 6 years. It was no joke at all. He died at 98 and a half, and he ran out of money at about 92. And my sister and I had to step up and do something about that. They lose friends, and am I going to get, a respiratory? Am I going to get pneumonia this year? How do I have to worry about tripping and falling? There are just lots. Sorry, I don't mean to sound like a doomsday person, but there are lots of fears to growing older. I have a service dog. She decided not to come tonight. But what she does for me is she keeps me focused on the sidewalk so that I don't trip and fall down. And that's another concern of seniors, and the curb cuts are great. I really like them a lot. I think downtown I can't think of a better place to grow older than in downtown Missoula. I really can't, John. But at the same time, people who are not old have to understand that those of us who are no longer young are grappling with some very real anxieties on a day-by-day basis. And I think there is more and more commitment to facing up to those things. I have to remember that my first few years I was a cripple, and then I was handicapped, and now I'm disabled, and that's all good. That's progress. And the ADA of 1990 is our civil rights, and it's the civil rights of anybody who is over 60 and has some physical disability. The place to play that out is not West Reserve Street, although that's an option if you got a lot of money. The place to play that out is downtown. It really is. Okay, it is 20 after 8. You've been very patient. We got started late. We're going to finish at 9 o'clock or sooner. And I'd be happy to entertain questions to any of us here or discussion points of discussion. Hi.
I was interested in hearing thoughts about the Caring Circles program. I work in the community and been involved in a couple of Caring Circles as a case manager, and I'm aware that originally was promoted through the Lifetime Demonstration Project, and I know that some of the people at Home Community-Based Services are still involved in it, but wondering if Aging Services is looking into the promotion of that concept, because it really fits into the volunteerism that you were talking about.
The Caring Circles model, you're right, it's been around a long time, and the way we promote it is by giving families with the model and helping them give it as a choice. And for those of you who aren't familiar with it, some of the churches are doing it too. It's where you gather around your support system, your friends and family. If you are caring for a person, if you're a caregiver in a home with another person that you're caring for, it can be pretty overwhelming. And so you create a system of people around you, a support system in which one person takes the leadership role in working with the caregiver and what their needs are. It might be grocery shopping, it might be getting lawn care, it might be transportation. And so only one person of the group works with the caregiver and then works with the volunteers, that support system, and basically giving assignments every week. This is what they need this week, and this is what we need you to do. So that's a very simplified way of talking about it. So it's all volunteer-based, and you largely pull together, as I mentioned before, neighbors, friends, family, church members, that have been associated with the family for a period of time. However, there's also a high demand for volunteers who are willing to do that for people they don't know, because they don't have support. The kids live out of town, or they don't have children. There's a pretty high percentage of elders that we refer to as geriatric orphans that never had children and are in positions. In terms of what we're doing about it is we could promote the model. We don't have it takes some time. We worked with the Life Ends Institute in trying to get churches involved, and there was a faith-based grant that was received that we worked with them and getting it going and trying to get started in churches. It does take a person really who's employed to work with families to help them assess who their support systems are. And it also takes, in terms of recruiting, volunteers who are willing to do that kind of work. And I think where we find our success in that is really more people under 55 than over 55, because they have more energy, or willing to work with older people than those that are closer in age, who can see themselves in those positions themselves someday. So it's a challenge, but I don't know if I necessarily answered your question, but we don't have really the resources. Nobody has the resources to do it all the right way, but we do have the information to help you if you're interested in setting one up with your own caregiving situation.
The most active person in caring circles right now is Kathy Flynn at HCBS. Okay. Any other questions? Hi.
I just wanted to comment on the conjunction between the caution that, or the information that you gave us, which is that half of seniors in Missoula are going to be living on $10,000 or less. And did I understand you correctly?
Yes, you did.
And
Actually, that statistic came from Susan,
Right.
or her agency, excuse me.
And yet there's so much emphasis on self-care and people taking care of themselves and making sure that they maintain their health and so forth by exercise and proper diet and so on. And those things really do not go together. I work with people of all ages, but mostly, the big lump is the middle age group right now. And people who have $10,000 or less cannot afford to join the Y. Really they don't have transportation, they don't have gas money, they have cars. I mean, these things, for half of our seniors, we really have to figure out a way to socially respond to these needs instead of leaving them up to individuals, because the individuals that I know who are motivated to eat nutritious food and to exercise, just for two examples, there's just no way. They can't figure out a way to do that. So we need to, I think it's one thing to emphasize self-care to people who are able to care for themselves, but a lot of our seniors and a lot of people coming up are not. And we have a lot of people who are not seniors who are living on $10,000 or less.
That's very true, and my specialty happens to be dementia, and I've given lots and lots of talks about it in the last 3 months or so around Missoula, mostly to churches, maybe to as many as 20 churches. And I think the churches are an enormous resource to people facing lack of money and getting older. I think that the church is the first place to turn to tell you the truth. It doesn't matter what the denomination is. So many churches have senior groups and have a commitment to helping those people who are living on $10,000 or less. So I really take heart on the basis of having visited all these churches, that they are a tremendous community resource for those people who don't want to go out West Reserve, couldn't even begin to afford $56,000 a year, and are living in trailer parks. And I think the church is the very first and best community resource that they can possibly get working for them. And the churches are there and they're doing it. Kathy?
I guess I want to make a couple of comments. I am so enjoying this. I'm a a registered nurse with a specialty in geropsychiatry, which has to do with mental health or the elderly. And I've made lots of observations and certainly interventions over the years. I want to speak out in support of the concept of elderly housing and how we can make that work in Missoula. I just reviewed a study that was published in Canada, where the Canadian government began to look at how they were spending their healthcare dollars and what could they do differently, because they also are feeling the crunch of the cost of healthcare, even under a socialized system. And one of the most remarkable discoveries was that their dollars could be better spent in the type of social situations that we're talking about. That you can't really separate the social impact on health and how important it is to look at those two concepts and blend that together. And by doing that, you're actually supporting the concept of self-care and health. So the environment is key. So I support this concept, and I hope that we can continue to have discussions, open public discussions about the issues that we're facing and trying to address for members of our community. Our elders are equal members in this community. So.
Nancy, did you have a question?
I just was speaking as a member of one of the larger churches. What's going on in our world and the cost of energy directly impacts them. Our church got 1 month power bill of $4,000. And, you know, I'm a contributor, grew up in that church, and we can't afford another pastor or anything else. And so I just use that as an example of the other forces that impact this generation as well, because just energy alone, and obviously these congregate living arrangements would be better use of the dollar. But the churches right now they're just drained. They're drained.
And public power ain't a bad idea.
No, gotcha. I'm with you on that, Ms. Lauren.
Well, and I agree with you, and if you look at the baby boomer, which again, I don't think the impact of that's going to be felt until, they start hitting 70, and in that regard. But that generation isn't as much tied to the faith community as our current elder population is. And I did want to mention too about low income. When I talk about some of our programs, they're related to subsidizing to help people do the very things. We have the Senior Diner Club that people get coupons that can go to restaurants we have contracts with to get more nutritional fresh foods, and they're able to. We have a farmers market program where low-income seniors can go and purchase, and if they can't go themselves, they can get a proxy or whatever you want to call it, who'll go shopping for them. In fact, that program is also available with WIC, and the seniors embrace it much more so than the WIC clients because they know how to cook the kinds of food you buy it. So there are those things, but those are the kinds of programs that we're having troubles are being cut. For example, we just had to start a waiting list the 1st of January on the Diner Club. We already have 27 people on the waiting list, people calling in because we don't have the financial resources for it. And it just speaks to that even if we're targeting to those lower income people, and there will always be low income people, that's where our public resources need to target. So that it's not the haves and have-nots, which our nation does really good at.
Anybody else? Mike, you have a question?
Me?
Yes.
Well, I can always think of one. Comment. Yeah. I forget which one of you gals mentioned neighbors. We find ourselves that elderly couple up on the corner surrounded by younger people. And it's been a wonderful experience.
Good.
I don't think I've ever met a miserable neighbor
Good.
wherever we lived, and
All right.
we lived all around here. For instance, one couple moved into a nice big house up above us, and the winter of the big snow. They couldn't get the car there, so they snowshoed down to our house and wondered if they could park the car there for a few days. Well, we invited them for lunch, and then one day, my wife fell and injured herself. Where she came from, I don't know, but almost immediately, there she was in the living room when I came home. And the gal across the street, always calling us up and telling us our garage is open and the light is on. So I finally realized the other night that instead of hitting the light switch, I'm hitting the... I injured myself one time. I was recovering from a total hip replacement, and I wrecked the rotator cuff. So they came over and carted us down to the doctor's office. And the people next door to us, he's a retired DOE guy. He was raised here as a kid. And we've helped them a time or two, and they helped shovel the snow between our house and theirs, which is one level up, so that we can get a wheelchair from our house to their house. And it's just a wonderful community. And I don't care where you live. We know people all over town because my wife is a native here. And neighbors are wonderful people, and it works both ways.
It does.
Good for
Very
you.
important.
That's the way it ought to work.
Yep, that's great.
Yes, ma'am.
I just want to comment on some of Mayor Ingen's comments before you were here. Susan was talking about this White House Conference on Aging and the 10 top priorities, and one of them is to promote innovative models of non-institutional care other than nursing homes, housing. And if that is in fact one of the top 10 priorities, it seems to me there may be grant money out there to promote the kind of downtown housing. And when I think of that, looking at the old boarding home kind of models where people lived in, I guess it would be like the cooperative living makes so much sense. And my concern that when I heard about Broadway and Orange Street, the condominiums there, is that they're priced well over $300,000,
Yeah.
which is fine again for those who can afford it.
Yep.
But it does seem like we need to emphasize looking more at the 5-bed or 10-bed kind of units that wouldn't have such an institutional feel, and that maybe groups of people can get together, or they're using the personal care home model, and people are accessing some of the operations to set them up so that as people need more care, they can integrate them, or they can live independently in that kind of setting. It is the current regulation in downtown set to allow for people to have space where they're can have 5 beds or 10 beds and do that type of building?
Yeah, the central business district is really, I hate to go too far, but fairly freewheeling. The constraints have almost everything to do with what folks are buying and what in effect pencils for the private development community. And that's been our difficulty. And Missoula is a city in its infancy, and a town kind of in its sunset. We're dealing with city issues. We're dealing with small metropolitan issues. And that's why we're just sort of starting to get used to the notion that condominiums work for people. You can own just your part of it, but you don't have a yard necessarily, and you have neighbors on the other side of the wall. That model is new to us. And so a lot of these other models that I think have been tested and work remarkably well in other communities, they're new to us. And so we need some pioneers, we need some innovators. And Bill's been working at this a long time, trying to find somebody who will step up and say, there's a market for this. I don't need to get rich doing it, but I don't need to go broke doing it either. And as you know, in the current federal climate, our community development block grant funds and our home funds, a couple of the financial resources we use to engage in this kind of program. We try to create housing for folks who can't necessarily otherwise have housing. And they have all sorts of issues ranging from, they can be elderly, poor, single, disabled, all over the map. Folks who just don't qualify under lots of other circumstances. I forget how old we all are, 2004, we lost 10% from that program. 2005, we lost another 5% from that program. And we don't know where the program is this year. So what we're looking for are development partners. We're looking for folks in the private sector who are willing to step up and say, I think there's a niche here, and I don't think I need to go broke. One of the interesting programs that's a little bit unsung is we've done this for folks who aren't necessarily elderly, but if you look behind the Target stores, which are, if you look just this side of Reserve, behind Target, there's an apartment complex called Union Place. Yeah, beautiful places. And, my first glance, and I'm sort of dialed into what's going on in the community, my first glance is nice yuppie apartments. Good, that's great. Somebody has another opportunity here. Well, those are anything but yuppie apartments. Those are built with federal tax credits. And in some cases, a 2-bedroom unit in those, I think, fairly beautiful apartments are on the order of $250 or $300 a month, which is remarkable in this community. And they're guaranteed to be that affordable over a certain amount of time because of the federal tax credit. I think if we can encourage some entrepreneurs to kind of chase that model and look downtown where we have real predictability, I think, anyway, real predictability in terms of our standards, we ought to be able to make some of those things pencil and encourage those kind of models.
Yeah, I've been looking at this issue some, and I do think there are quite a few tax breaks for housing for the elderly. We read some regs on it, and I can't remember all of the terminology, but there is an incentive there. And it dovetails to be downtown with the Caring Circles model in terms of integrating neighborhoods and the churches and having people have easy access to come over and watch a football game or take care of various activities that people need help with.
Yeah. And neighborhoods, that's what neighborhoods have traditionally done. This house on 2nd Street, my job was to go over to Mrs. Lean's house across the alley, and I'd change out her storm windows. And my mom, who had an ethic of service, she later in life did all sorts of things, but she'd put up hair and converse and have coffee, and that's what we all did, and that's what I learned to do. And those are the things that I think downtown can promote. That kind of proximity makes a lot of sense. Can you imagine being a young person just starting out? You've got a little kid, you may be new to the community, and you've got somebody who knows what the hell they're doing, living next door, who might be able to offer you some advice. Wow, how terrific is that? Or maybe even, sit for you once in a while. That's all good. But we're trying to figure out how to do all of those things. And our market is such that we sell $300,000 homes in this community, and we sell $220,000 homes in this community, and the median price for a home is about $180,000 in this community, and those homes are still selling. So the development community is saying, I will build homes at those rates, and they will sell. And I think we're going to come into some folks who understand the niche and the need and the long-term future of the community. And again, this is the place to do it, and my door is going to be open to encouraging that.
It seems like the promotion of it among, professionals who are aging, who are living in the expensive homes, who in the long run, 10 or 15 or 20 years from now, are not going to be able to maintain them, but getting, more outreach people to think about investing in these types of
Yeah.
co-ops for their own future that could essentially maybe be rentals now. It would make a lot of sense.
Yeah, we're just waiting for somebody to tip. Somebody's gonna figure it out. And I frankly wish that, you know, municipalities and counties we don't have the resources to make those things happen. What we can do is regulate in such a way to encourage that sort of thing. And the other thing we need is folks knocking at our door and reminding us again and again and again and again that we need these opportunities, we need these choices for folks.
Were you aware of that statistic about the people over 60 that are living off less than $10,000?
You know, I didn't know this statistic, but it doesn't.
What was it again? It was over 1 out of 8 living on 10,000.
That's correct.
I mean, doesn't surprise me a lot. I mean, you know, that's the thing about our community is Bill will tell you. I mean, you know, we're a growing, thriving place, but there are lots of folks who are just making it and maybe not making it.
John, thank you very much. I really appreciate you coming this
Oh,
evening.
it's my pleasure. Thank you for having me.
Linda, Susan, and thank you all very much for coming to Home for a Day for the future.